This is Charter Local Edition. I'm Brad Pomerance. We are at the National Association of Counties Convention in Long Beach, California. And it's my pleasure to introduce you to Kathy Long. She is a supervisor in beautiful Ventura County. I grew up near Ventura County, but not quite in it. And boy, has Ventura County blossomed into just a crown jewel, but we're not telling anyone.
No, it's a secret.
It's a big secret. Tell us about Ventura County, what makes it so desirable.
You know, we're a coastal county,
right,
and we have 10 cities, and all of the cities have curb limits, so the growth occurs in the cities. Agriculture is still our strongest economy. We have a nice, diverse economic base: Baxter, Amgen, Patagonia.
Right. I can't tell you how many people I know that work for Amgen,
yes,
and they commute to Thousand Oaks, I think it is.
Right.
What a great economic engine. I also must admit, your outlet malls, I think not far from your home. I mean, those are some fantastic outlet malls.
Yeah.
And then recently I went to a soccer tournament for my daughter at Cal State Channel Islands.
Right.
Which was?
So it used to be the state mental health facility. It's now the newest public university in the system, and it's doing quite well.
It's got to be very exciting to think that Ventura County really is that county that's on the move and moving forward.
Yeah.
I do want to speak with you though about an issue that is challenging, and that's the question of foster children. It's undeniable that our society continues to grapple with the challenge of children placed in foster care. You've been a champion of foster kids for a long time. Talk to us about the challenges facing your county, which is not LA County, and they have their own set of challenges.
Right.
You know, a county of about 800,000 in the foster care system.
Right. And our county, and that is true, we're small enough that we have a manageable public policy issue to deal with the foster children. All of the board members feel like we are the parents for these foster children.
Nice.
So we have embraced the public policy goals of helping them. 1,000 children, 500 families. We're always recruiting for foster families because we still have needs. And if, as a parent, you think about what are you most challenged with, and typically it'll fall with your child's health. And are you making sure they're getting the immunizations they need and the health care support?
And let's talk about that, because Ventura County has become a forerunner. What's unique about Ventura County, though, as it relates to foster children, is because your economy is agriculture-based, I presume that brings up separate issues for children that may get lost in the system. They may be migrant. There may be questions of documentation.
Right.
And so how do you deal with those challenges?
Well, we're fortunate with our Human Services Agency and our Healthcare Agency. They're integrated. They talk with one another. They work together. So the care that a child needs to make sure they're getting whatever assistance they should get through the social service system or healthcare, again, they talk to one another.
So I want to talk about something you just hinted at, and that is Foster Health Link, a program that was piloted in Ventura County. Tell us about Foster Health Link.
It is a technology that we are now providing to our foster families so they have access to a child's health records, access to a child's, we're working on connecting school records in, but their health records, where have they, what foster parents have they had, because sometimes foster children will have 2 or 3 different families they'll go to. So they will have an app available on either a smartphone or computer that they are we give them authority to access as the foster family. They get an ID number, and they can literally go in and look at a screen and look at all of the child's health records, who the foster families have been that they have been to, what schools they're going to.
Who handled that before? I mean, I can't imagine a child comes to your home, a precious gift, and you don't know if they've had a tetanus shot.
Well, that's it. You don't.
So what did you do before?
It was all paper. It was literally a binder that would either travel with the child or go to the families, and it wasn't always up to date. May have had inaccurate information, and just wasn't a connected, solid piece of information tool for the families.
So the program, like we said, piloted in Ventura County. How did it do? Was it successful?
Oh, it's fully up and running. It's very successful. We're hearing from the families how appreciative they are of having that ready access to the information. So they know if a child has an allergy to peanuts, they know right away when that child enters their door. They get the info. They can go online, look at the profile on the child. It's a sharing of information. They can't go in and change any records.
Sure.
So there's that protection for both the child and the families. But it's just gives them a great sense of empowerment and appreciation.
Now the question is, we know you piloted the program. Is the program now rolling out in other counties throughout the state of California?
Well, that's why we're here at NACO.
Exactly.
Yeah.
So let's talk about it. This morning, in fact, there was a presentation. Were you on the panel? Were you
Yes.
Okay, so you
Yes.
were part of the panel.
Right.
It talked about this breakthrough in electronic management
Right.
for healthcare. Tell me about how the panel went. I mean, this is the National Association of Counties, so you had
Right.
folks from all 50 states learning
Right.
about your pioneering work.
Right. It went very well. There were lots of questions from states like Indiana. The question was, well, the state runs our foster care system. Can they embrace this technology? The answer is yes. They'd have to agree to come to the table, figure out how to have the portals connected, and it really is, it's the technology.
How did Ventura County become the first?
Well, it really took about 7 years where we started the conversation with the foster families. What do you need? And that was their first priority. We need to know what the medical records are of these children coming through our door, all the issues related to the other families or schools. So the agencies of healthcare and human services started a roundtable discussion, and then looking at what technology was available. And
so did you work with an outside vendor? I mean, this...
yes, we did.
I mean, this is
Developed
incredibly
by,
exciting to
right.
think that you were at the table.
Right.
Because so often there can be a disconnect.
Right.
And so you were able to provide that valuable information.
Right.
And now this outside vendor, God bless them, will be able to take the program state and national.
Oh, it's immediately replicable to other counties and states. In fact, they're talking to the state of Texas right now that is having significant issues, court-ordered issues with foster care. So it's just a tool that empowers families, and that's the beauty of it.
Does this tool help children that may age out of the system? Because that, you know, is a big challenge.
Yes.
Once they turn 18,
Yes.
I mean, fortunately, we are no longer just pushing them onto the streets, but there's that 18 to 24 gap
Right.
where they may need additional support.
Right.
Can that follow them as adults?
Yes, it can. They will certainly receive all of the permanent records. And the beauty of our system is we run our own public health care system. So we have 2 public-owned hospitals and a health care insurance plan that we insure the foster kids in our system. And now with going till age 24, that continues with them. So there is that benefit.
You must be incredibly proud
to
have been part of this, and now
Yeah.
to be able to bring it to the rest of the nation and explain how this really changes lives. I thank you for doing that for the children of Ventura County and really all of California and the nation. We are at the National Association of Counties Convention in Long Beach, California. We are joined by Kathy Long. She's a member of the Board of Supervisors in stunning Ventura County, vivacious Ventura County. I'm Brad Pomerance, Charter Local Edition.